Now to the very latest on the coronavirus here in Connecticut.
I think it is literally nothing short of the equivalent of putting a human being on the moon.
The first step in the long battle to defeating the pandemic started today. The first doses of the vaccine are going out to frontline workers with the goal that all will get it by the end of January. Channel 3 Eyewitness News reporter Matthew Campbell is live at the digital desk. And Matthew, this is a step in the right direction, but unfortunately, the virus is not just going to magically disappear. Yeah,
Aaron, you're right. Doctors are really stressing that point, and we wanted some firm answers on this. So we asked the governor and his panel today when we might start to see a positive impact on today's 6% positivity rate, and they say it's still going to be a few months.
It's been less than a year since the first confirmed coronavirus case hit the U.S., and today, the first doses of the vaccine are being administered.
I'm just incredibly excited and enthusiastic to roll up my sleeve and get this vaccine in me.
The state is receiving nearly 16,000 doses, and here's where they're going this week. Hospitals up 95 and 91 and across 84 are receiving them, but notice how the northwest, northeast, and southeast corners of the state don't have them yet.
Starting next week, we'll start getting doses out to federally qualified health centers, local health departments, and other providers.
Next week, nursing homes will start vaccinations, and by the end of the year, the goal is to have around 100 providers qualified and trained to administer the vaccine. Today, we're also learning there's still a challenge in establishing confidence in the vaccine. Dr. Keith Grant from Hartford Healthcare was one of the first in the state to get the shot.
A lot of people, when asked, will you get the vaccine right away? The number right now, I think, is about 45% of people says absolutely yes.
With Pfizer alone hoping to have 1.5 billion doses of the vaccine in 16 to 18 months, this could create a situation where eventually we may see doses outpace the actual demand.
My hunch is that demand will outstrip supply for the next 3 or 4 months. Then that may shift as we move into late spring, summer.
If the unwillingness to get vaccinated grows stronger during these first phases, Governor Lamont says the general public might get their shots earlier than expected.
Well, I'm certainly not going to let the vaccine go to waste. So the answer to that would be yes. But I have a feeling that every day, like I said before, you're going to see somebody like Dr. Grant. He took the vaccine. There were no side effects. It felt good. He feels safer. And I think that that's what it's going to take to get from 60 to 70 to 80 to 90% of the people willing to get this vaccine.
All right, so let's do some numbers. 90%, that's the vaccination goal for the state. 95%, that's how effective the FDA says the vaccine is for adults 18 through 64. And then finally, 40 to 60%, that's how effective the FDA says the flu shot is, just for comparison. Live here at the digital desk, Matthew Campbell, Channel 13 News.